Hello there, I'm TheWhizDoc. I'm a board certified family medicine physician. Today we'll be talking briefly about HIV and AIDS. This is to better educate you about what those terms mean and so that you do not use each term in the wrong context. So let's get into it. So first of all, HIV, also known as the human immunodeficiency virus, is a virus that tends to affect your immune system by attacking the cells that helps you fight off infections. This makes you more vulnerable or susceptible to other infections and diseases. So, how is it spread? HIV is spread by coming into contact with the bodily fluids of an individual that is positive or infected with HIV. The most common cause is through sexual intercourse. Other ways that you can get HIV could be through sharing injection or drug paraphernalia, also during pregnancy and birth from mother to baby. The human body cannot get rid of the virus by itself. It is important to note that there is no cure for HIV at this time. So, if you get infected and are positive for HIV, you will have this for life. Notwithstanding, there are medications out there called antiretroviral therapy that can help individuals positive for HIV live long and healthy lives. It also helps prevent transmission of the virus to their sexual partners. In addition, there are other effective ways to help prevent getting HIV, either through sexual intercourse or drug use. These methods can be called PrEP or pre-exposure prophylaxis and PEP or post-exposure prophylaxis. And finally, please understand that regarding HIV, if you test positive, get treated. If you do not get treated, it can advance to a late stage called AIDS, which is also known as acquired immunodeficiency syndrome. So now let's talk about AIDS, acquired immunodeficiency syndrome. This is the last stage of the HIV infection and the most severe stage of the infection. During this time, your body's immune system has been so severely damaged that you can't really fight any other infection. People that are diagnosed with AIDS without treatment usually survive an average of about 3 years, and usually this number drops to a year if you have an opportunistic infection during this time. In the US, most individuals with HIV do not progress to AIDS because they take their prescribed medications every day, and this stops the progression of the disease to AIDS. An individual with HIV is typically diagnosed with AIDS if the CD4 count drops below a certain threshold, or if they are diagnosed with an opportunistic infection regardless of the CD count. HIV medication, in particular the antiretroviral therapy, can still be helpful at this stage and can also be life-saving, but it is beneficial or most beneficial if it is started early on in the illness or in the infectious process, and that is why regular testing is very, very important. And finally, we've come to the end of this video. Hopefully, I have been able to point out what HIV is, what AIDS is, and the differences between both terms so that we can use them in the right context. If you have any questions, any concerns, or any comments, please drop them down in the comment section and I respond to all comments. I'm TheWhizDoc. Have a great day. Stay safe. Stay happy. Bye.